reason or another, our body will hurt. Maybe we accidentally hit our finger with a hammer, and now the finger is painful, swollen, and warm. What can we do? We can take an NSAID, or non-steroidal anti-inflammatory drug. There are a lot of them, and the two most well-known are aspirin and ibuprofen. Ibuprofen is what's used in Advil. So how do NSAIDs work? To understand, we will have to go to the cellular level. When our body is injured, like when we hit our finger with a hammer, chemicals are released from our cells to address the problem. One such chemical is arachidonic acid. We'll call it AA. AA gets chopped up by an enzyme called COX-2 into smaller chemicals called prostaglandins. Prostaglandins promote the sensation of pain, fever, and swelling. So what was the point of all that? Well, NSAIDs destroy COX-2. With less COX-2 to chop up AA, there will be fewer prostaglandins to promote the sensation of pain, fever, and swelling for injuries, arthritis, menstrual cramps, and headaches. Okay. So there's also a COX-1, and COX-1 also chops up AA to form prostaglandins. However, the prostaglandins formed by COX-1 are used by the body to do various effects. One effect is to stimulate the stomach to secrete mucus. This mucus is important to keep the stomach's acid from digesting the stomach. In addition to prostaglandins, COX-1 makes a chemical called thromboxane. Thromboxane stimulates blood vessels to constrict, but more importantly, for platelets to form clots or a scab. If you haven't guessed, most NSAIDs also stop COX-1. So if we stop COX-1, we increase the chance of the stomach digesting itself and forming a stomach ulcer. In addition, we increase the risk of bleeding in the body. Lastly, the kidneys use both COX-1 and COX-2 to chop up AA into prostaglandins that stimulate blood flow to the kidney. Without COX-1 and COX-2, the kidneys will have less blood flow. If the kidneys get less blood, the kidneys will get damaged. For these reasons, your doctor will want to ask you questions to decide if taking NSAIDs is safe for you. These questions include if you are taking blood thinning medications such as warfarin, for the reason that NSAIDs will stop COX-1, which will stop thromboxane and stop the body from forming scabs. Also, if you are taking medications that reduce blood flow to the kidney, such as lisinopril. Also, if you have any medical conditions such as heart failure, because both lisinopril and heart failure will decrease blood flow to the kidney, and we don't want to add anything on top of that by giving NSAIDs. With me, I have Advil, and Advil uses ibuprofen in order to provide pain relief and reduce fever. On a bottle of Advil, you'll notice that in bold letters, well, I can read it for you. It says stomach bleeding warning, and for the reasons we've already explained, that without COX, the body can't make prostaglandins that promote stomach mucus formation and blood clotting, resulting in a bleeding stomach ulcer.